virus that can cause a wide range of illness from the common cold to severe disease. So this is a virus that is known already. So we have, as mentioned, we can have diseases like common cold caused by human coronavirus, but also we can have severe disease like a severe acute respiratory syndrome, SARS, that caused the epidemics in 2003 and 4, and also Middle East respiratory syndrome that can cause severe respiratory diseases. But now we have a novel coronavirus that is called SARS-CoV-2. This is the name of virus that caused the disease COVID-19. So this is a new strain that has not been previously identified in humans. That's why we have so many susceptible people, because the human being is not used to this virus, so all the people are susceptible to get infections caused by coronavirus. And this explains a lot why so many countries are affected so far. Of course, because the globalization, several travels and communication between countries, this is spread more quickly, but particularly this SARS-CoV-2 has a particular characteristic of being quickly spread. So you can see almost all over the world has at least 1 or 2 cases, but some countries are pretty much more affected. So another thing that is important to know, and this is related also to cleaning environment, this is that we have a kind of signs and symptoms related to COVID-19 that are related also to the mode of transmission. You can see that people in general, they can have fever, but also they can have respiratory symptoms like cough and sneeze and shortness of breath or breathing difficulties. So, and because people are coughing and sneezing, these viruses that are in the upper respiratory tract can go to the environment. So that is important. Of course, other symptoms are as well possible, such as headache, and in more severe cases, including kidney failures, can also happen. So, and then once we know the signs of symptoms, we can also understand a little bit the mode of transmission. So we have virus in the upper respiratory tract system, and during the cough and the sneezing, the virus can go to the environment through droplets. So this is one mode of transmission. So respiratory droplets are generated when the person infected cough or sneeze. So anyone that is in close contact, more or less within 1 meter with someone with such respiratory symptoms can be at risk of being exposed to potentially infected respiratory droplets. And then these droplets go to the environment, so they land on surfaces, and a virus can remain viable. So the immediate environment of an infected individual can serve as a source of transmission. That's why we have droplets and contact transmissions as a mode of transmission. But also, depending on the type of procedures, if someone in the healthcare settings do aerosol generating procedures, we also have the transmissions, airborne transmission. So, for example, this can be induced or mechanical generated aerosols during the intubation or during mechanical ventilation. So that's why we added this mode of transmissions for particular situations, not all the time, but particular activities that can generate aerosols. So what do we know so far about the environment survival? So let's have a comparison here between the SARS-CoV-2 and other viruses. For example, if you know, we have other pathogens that are very common in healthcare facilities, such as methicillin-resistant Staphylococcus aureus, Acinetobacter, or Clostridioides difficile, vancomycin-resistant Enterococcus, E. coli, Klebsiella, and norovirus. So they all have also potentially survive on surfaces, but different ones. So, For example, methicillin-resistant Staphylococcus aureus can survive up to days and even months if environment is not cleaned. So it of course depends on the temperature, humidity, the type of surfaces, but definitely we have other pathogens that survive in surface. That's why environmental cleaning is so important. But compared to these pathogens, although SARS-CoV-2 has some survival in the environment, remain up to 7 days, depending on the type of surface. As you can see, for example, wood today and plastics and stainless may survive 7 days. So this was got in one study. In another study, observed 4 days. So it will depend on the surface. Of course, it will depend on several situations. And that's why we need to clean the environment. And that's why fomites are so important in the chain of transmissions. So talk about chain of transmissions. As we know, to get an infection, we need this chain of transmission. So we have the infectious agent, we have the reservoir. In this case, it can be the human being as the reservoir, but also it can be the environment. And then the pathogens that are in this reservoir goes through the mode of transmission. That means droplets or contact, and enter in a susceptible host. In this case, when we talk about COVID-19, we are talking about entering by mucous membranes. For example, eyes, nose, and mouth. That's why it's so important we have clean environment, because if people touch the environment and then they touch themselves without doing hand hygiene, they can become contaminated. But for an infection to spread, all links must be connected. But if we break one link, we can cut the chain of transmission. That's why it's so important to try to work and understand the mode of transmission and how to interrupt the chain of transmission. So as you can see in the next slide, we have this environmental cleaning in healthcare. So cleaning and disinfection, or we can use disinfection in some situations based on the risk assessment. We are talking here today about the cleaning and disinfection of environment surfaces for non-critical patient equipment or other surfaces such as tables, chairs, floors, walls. So everything around the infected patient can be contaminated. So this is the environment. So, and then if people touch this environment around the patient without proper hand hygiene, they can contaminate themselves or contaminate other patients, or even bring this contamination to the family. So what we need to have here is an emphasis in surfaces that are frequently touched. That's why the link between the fomite, the environment reservoir, and the individual that can become contaminated. An example of non-critical patient care equipment means an equipment comes into contact with intact skin, not mucous membrane, because in this case, this is not non-critical. And we have here some examples such as blood pressures, monitors, stethoscope, mobile computers, and workstations, incubators, in a wheelchair. So this is our focus for today. Today we are not talking about other devices. We are talking about this environment and no critical care equipment. So again, it's important to highlight the relevance of hand hygiene in the chain of transmission. It's always important to say that if an environment is contaminated, and that's why we need to clean the environment, but if you don't clean and people touch, they can be contaminated. So both together, the environmental cleaning and disinfection and hand hygiene are partners in this action to reduce the risk of transmission. So our hands are our main tool for working as healthcare workers, and they can be the link in the chain of transmission, but we can cut it by doing hand hygiene and cleaning the environment. So what are the key messages for the environmental cleaning in the context of COVID-19? So as I mentioned, SARS-CoV-2 can survive on an environment surface for days, but the environment survival is low compared to many other important pathogens. Environmental cleaning is very important to mitigate the spread of COVID-19 through the contact transmission route. Environmental cleaning using existing best practice methods and the strategy that we already use in general is effective against SARS-CoV-2, and Molly will talk about it following. And as I mentioned, SARS-CoV-2 is susceptible to the majority of standard environmental cleaning agents and disinfection methods because this is an enveloped virus, so it's not very hard to eliminate SARS-CoV-2. So this is a good information, good news for us. And at this point, I would like to thank you again and hand over to Molly, and I am open to questions if necessary. Thank you very much. To you, Molly, over.
Great, thank you so much, Maria Clara. So I am just going to the next slide here. Maybe just a quick reminder before I move on. The questions coming in are wonderful, but it would be great if all of the other attendees could see them. So when you send a question, if you could send it to all attendees, that way everyone will be able to see the questions that are being asked in the chat. Thank you for that. All right, so good morning, good afternoon, everybody. So I am going to now transition into talking about some of the latest and best practices guidance on environmental cleaning in healthcare facilities. So I'm going to pick up where Maria Clara left off. As she said, I'm going to try to emphasize these two main messages here. So hopefully this will be clear throughout the presentation. And before getting started, I wanted to highlight a few key documents for environmental cleaning in healthcare. So the document on the left, I'm sure you are all very familiar with, but that is the Essential Environmental Health Standards in Healthcare, which includes really critical and fundamental information on environmental cleaning that is still relevant today. It's particularly applicable in smaller facilities and in outpatient settings. The document in the middle, it's a little bit unclear, the title, but that is an implementation manual that WHO published last year, focusing on prevention of key multi-drug resistant organisms, and it includes a whole chapter on environmental cleaning. It is probably more applicable in a hospital setting, but it is a very good reference document. And the document on the right is a best practices document that was jointly published by CDC and ICAN last year. And that includes best practices for environmental cleaning in all healthcare facilities. So it is relevant in any healthcare facility, but likely has more content for larger facilities and hospitals that may be helpful. So,
hi, Molly. Molly, sorry to interrupt you. You're coming in and out a little bit. Could you just move your microphone a little closer?
Oh, sure. Is that better?
Yes, much better. Thank you.
Yeah. Okay. Sorry about that. So the links for all of these documents are included at the end of the presentation. So if you don't have them, you can feel free to download them. And another point that I wanted to make is that these documents were used to develop the indicators for environmental cleaning that are included in WASH Fit. So both within the current version that is available and the expanded indicators that will be included in the new version that should be coming out later this year. So these are great reference documents to have as you're using WASH Fit. As far as resources on environmental cleaning for COVID-19, I also just wanted to highlight the technical guidance page on IPC and WASH that is available on the WHO website. There are some materials there presently that address environmental cleaning in the context of the pandemic, but there is going to be a new standalone guidance document on environmental cleaning for COVID-19 that should be published within the next 1 to 2 weeks. So we'll make sure that gets sent out, but definitely continue to check out that website for that resource. So some of the guidance that will be included in that document, I will cover today. All right, so as Maria Clara outlined for us, environmental cleaning is critical to prevent the spread of infections in healthcare. And as such, it is one of the standard precautions for IPC, which means that it should be practiced in all facilities and at all times. So definitely not just during an outbreak situation. It should be practiced routinely to prevent infections and outbreaks from occurring. Very similar to hand hygiene in this regard, and we saw that it is a very related intervention. Also similar to hand hygiene, environmental cleaning requires a multimodal approach. So when we say that, what we mean essentially is that it requires multiple methods or multiple strategies to be able to be implemented effectively. So what are those strategies? The main sort of categories of the strategies that we should use when we're thinking about making improvements to environmental cleaning are listed here, 1 through 5. All of these strategies are covered in much more detail in the CDC and ICAN guidance document, so that is a good reference for more detail. I will not have time to go through in detail today, but what I will try to do briefly is go over the first 4 items, and I will spend a little more time talking about procedures and some of the supply considerations, because there are some aspects specific to COVID-19 that we want to share. So these strategies should be used in all healthcare facilities, no matter if you are in a small facility or a large hospital. There is something that is applicable for your setting, and they are also something that we should be considering and taking into account and planning for at a facility level, no matter how the cleaning is conducted at our facilities. So even if there is an external company that comes in and is contracted to do the cleaning work, these are still aspects that we need to plan for at the facility level and that we communicate to the contract company to make sure that cleaning is implemented well. All right, so just some highlights here on what we mean by organizational structures. So what organizational structures need to be in place? There are 3 main aspects here. The first is that we really need to have strong leadership support and administrative support for cleaning. So that means that we need to have a focal point, a focal person identified who is a facility staff person who is really responsible for managing the cleaning activities. It does not need to be a full-time position depending on the size of the facility, but in a hospital setting, it would definitely be a full-time job to manage the cleaning activities. At the leadership level, we need to make sure that there is development and that there is validation and buy-in on a cleaning policy that is specific to the facility. And of course, it is very important to have a budget allocated to support cleaning activities. The second component is that we need to make sure that the cleaning program and activities are really integrated across the facility, because cleaning is very cross-cutting. So we have to make sure it's strongly integrated with the IPC activities. We also need to make sure that wash personnel are involved in cleaning, that procurement personnel are involved in cleaning, and even all of the ward in charge staff need to understand that cleaning is important and need to know how it is supposed to be conducted in the facility. Finally, we need to make sure that there are strong management and supervisory structures in place. So ideally, we would even have the staff who are involved in cleaning outlined in an organizational chart. And very importantly there, we would want to make sure that every person who does cleaning, every cleaning staff actually has a supervisor on site. And that is important both so that the supervisor can provide supportive supervision and mentoring, and also so that the cleaning staff knows who they can go to if something comes up during the day. A little bit more on staffing and training. So Cleaning, as Maggie said, is a very neglected area. We know in many cases, maybe there are not, it is not even a paid position, maybe it is volunteers who are coming in to clean at facilities. And we really do need to try to all work together to make sure that cleaning staff are recognized as critical infection prevention control staff, and they should be paid positions, they should have a job description, and they should really be a part of the facility staff. We also need to make sure that we have enough staff so that we can actually perform cleaning according to best practices. We know that this is a big challenge. Any staff who is involved in environmental cleaning, so both dedicated environmental cleaning staff or maybe even nursing staff who may conduct or who may perform cleaning, need to be formally trained on how to clean. There needs to be an introduction to IPC to make sure that they understand how to protect themselves, and the training should also have lots of hands-on work and practice. There are some other best practices for training that are highlighted here in the box on the right, so you can read through them there. So it's very important the training is participatory, that it's very hands-on, and that it is delivered at the appropriate level and in the appropriate style. And ideally, it would be conducted before staff are asked to work on their own, or at least annually. So I just wanted to say a couple words as far as lessons learned from implementation on training. And this is a package that really demonstrates the best practices for training. It is called Teach Clean. Some of you may have heard of it. So many thanks to Wendy Graham, who has provided this slide. So Teach Clean was developed by the Soapbox Collaborative and the London School of Hygiene and Tropical Medicine. You can get a free copy of it. It is available online, and the link is available at the end of the presentation in the references. So this training package has been developed for frontline cleaning staff in general wards. It has a particular emphasis on the maternity setting, and it has been implemented in a number of countries, and a number of very valuable lessons have been learned from implementing this training for cleaning staff. So some of them are listed there, and you can learn more about them on the website, but a couple of points to emphasize, the second to last bullet there. You can see that it is so important that training is matched by regular availability of supplies and equipment, and also that post-training supportive supervision is really key. So again, this emphasizes the need for us to sort of use these multiple strategies when we're trying to make improvements to environmental cleaning. So we can't just focus on one thing. We need to try to think about how all the pieces fit together. All right, so now to move on to talking about a little bit about policies and procedures. So as I mentioned, the facility, at a facility level, there should be a cleaning policy that is developed. It doesn't need to be standalone. It could be within the overall IPC policy, but ideally it should include the elements that are listed here. So it should include all of the reporting lines and the outline of the staff who have responsibilities for cleaning. It should include the cleaning schedules for the facility, the training and monitoring requirements, and also what are the approved products and supplies for cleaning. There is an example, it maybe is a little bit fuzzy, of a cleaning schedule here in the table on the right. So what a cleaning schedule is that it could be in a table, and basically it would outline at a high level what is the recommended frequency, who is the person responsible, what are the products that are used and the technique that is used, and any other additional high-level guidance. And this should be developed for every different kind of patient care area. So for every ward or every service that is available in your facility, this outlines when and how should cleaning be conducted. So SOPs, or standard operating procedures, really follow from there. And those are the things that really provide the details and the instructions, the really detailed instructions for how cleaning should be conducted. So again, you should have an SOP for every patient care area. So that's the instructions for how to clean. It should include the step-by-step process, in the order the steps should be performed, and it should include the products and supplies and equipment that are required for cleaning in that area, including the PPE that is required. All right, so a couple of, this is a lot of information, but we wanted to include some of the recommended cleaning schedules in the context of COVID-19 for you. So this table will be available in that document that should be published very soon. So you can refer to that for more details. So you can see the patient care areas that are outlined here. We have a recommended frequency for cleaning in those areas, and potentially a person or staff responsible for doing that cleaning. This would have to be determined at a facility level, but these are just some recommendations. For products and supplies, I will get into that next, so I won't really talk about that now. What are the cleaning and disinfectant products that we recommend? But I will explain that. But a couple of other notes as far as the best practices and what we should be trying to do is we should be making sure, if possible, that we are using clean supplies and freshly made solutions every time we are cleaning in COVID-19 wards. We should make sure that any reusable supplies are sent for reprocessing immediately after cleaning, so that those items should not be used in other areas if possible. If possible, we should try to have dedicated cleaning supplies for COVID-19 wards. The personal protective equipment recommended for cleaning staff in COVID-19 wards is also included there. And then in additional guidance, what we have is just a few words basically on what would be the areas of emphasis and also the order that the cleaning should be conducted. So an SOP would have to be developed in detail for each of these different patient areas at your facility, depending on the services you have and the situation there. But there are some key principles here as far as the order. So for example, if we're looking at the second row, so when we have an inpatient room or a cohort area where we have patients, you can see that the recommended order that we would start with surfaces further away from the patient and then work towards each patient bed. So I do determine this at facility level. There are some best practices as far as the order of cleaning that would not change at all. They should always be in place. So I wanted to just briefly review them. So we always say that cleaning should proceed from cleaner areas to dirtier areas. And there are some practical examples of what that actually means in the bullets there. So for example, the first bullet, we say that we should try to clean high-touch surfaces outside of the patient zone before high-touch surfaces inside the patient zone. And you can see the picture on the right sort of illustrates that, how we would move. And the reason for that is that the contamination level increases as we move into that patient zone. So we want to try to clean from cleaner to dirtier. We also want to make sure that in general we're proceeding from high to low or top to bottom. So we want to do that basically because contamination may drip or fall down towards the ground as we're cleaning. So a good example of that is that when we're cleaning a bed, we would always want to make sure to clean the bed rails before the bed legs, for example. And that is also why we always recommend that environmental surfaces are cleaned before floors. So generally floors would be cleaned last. A third point here is that we generally want to try to have our SOPs so that cleaning can proceed in a systematic manner. So there is no right or wrong way to do this. It depends on how your facility or your ward is laid out. You can see an example on the right for how this might look. So it could be clockwise or counterclockwise, but the reason to have cleaning try to proceed in a certain order is so that we don't miss areas. All right, so now talking about supporting infrastructure and supplies, and I know that this is a WASH group, so there is lots of interest in this section here and what we need for WASH. So there are four main aspects here that we consider. The first is that we need to make sure that we have dedicated space at the facility to accommodate all of the environmental cleaning supplies and an area to conduct decontamination of equipment. We really need to make sure that there is adequate water supply and wastewater is safely managed at facilities so that we can make sure that all of the water that we're using for environmental cleaning is safely managed. And I did just want to point out again that the domains for water and wastewater in WashFit really do take into account what you would need to be able to perform environmental cleaning. So it just shows again how the domains in WashFit really fit together. The third aspect there is that we should have, ideally we should have a list of products that are approved for use for cleaning at our facilities. And then we should make sure that we have the supply management systems that we need to make sure that we don't have stockouts. I'm going to transition into focusing a little bit on environmental cleaning products and disinfectants because we have been getting lots of questions about that for COVID. So before doing that, just a couple basic definitions before I get into talking about the products. So just so we know, so cleaning really is about the physical removal of dirt and organic material from surfaces. So it physically removes rather than kills microorganisms, and generally it's achieved with water, detergents, or soaps, and using mechanical action. So what we mean there is basically friction or scrubbing. And cleaning is always the first step in the environmental cleaning process. And disinfection for environmental cleaning is a chemical process for inactivating or killing microorganisms on inanimate objects. So disinfection and disinfectants are only applied to inanimate objects. They are never applied for humans, and they are never supposed to come in contact with the human body. So disinfection occurs after the cleaning process. There are different levels of disinfection depending on the intended use of the item that is being disinfected. So for environmental surfaces and non-critical equipment, we have to conduct disinfection to a low or a mid-level. So high-level disinfection and high-level disinfectants are not used for environmental cleaning. So they are used when we need to have a higher level of disinfection, for example, for invasive devices and devices that are actually entering the body. And in many cases, sterilization is required. So moving on to cleaning products and disinfectants. So cleaning products can be liquid soap or other cleaners or detergents. Generally for environmental cleaning, we would recommend, if possible, using a neutral detergent, something that can be soluble in warm or cold water. For disinfectants, for environmental cleaning, as I said, generally low-level disinfectants are used most commonly, but there are cases where we may need to use mid-level disinfectants. And there are some products that combine a cleaner with a disinfectant. So it is sort of a two-in-one product. And those are also okay in many cases for environmental cleaning. But there are some situations where we need to use separate products and have a separate step for cleaning and disinfection. One example of a situation where we would need to have separate steps would be if we were cleaning a blood or a body fluid spill. Okay, so I want to spend the last few minutes talking about disinfectants because they're,
Molly, we can still see your slides, so hopefully your audio is okay.
Can you hear me?
Yes, we can hear you. Please go ahead. Thanks.
Okay. I just want to spend the last few minutes talking about disinfectants because we're getting lots of questions.
Actually, you're a bit faint, so if you can come closer to the mic. Great. Okay.
So we are getting a lot of questions about disinfectants and what disinfectants could work for COVID-19. So I wanted to spend just a few minutes here at the end trying to talk about how it is that we can know if a disinfectant will be adequate for our purposes. So the idea here, if we look to the left, this is called the disinfectant hierarchy. So basically what this does is it lists the major types, classes of microorganisms according to their resistance, intrinsic resistance to disinfectants. So up at the top, we have bacterial spores, which are most resistant to disinfectants. And as we move down, we move from less resistant to most susceptible. So at the bottom, we can see that the most susceptible are the enveloped viruses. So that is good news for COVID-19. Another thing to point out here is that for viruses, we can see that non-enveloped viruses are much more resistant to disinfectants than enveloped viruses. And we also have a type of bacteria called mycobacteria that is much more resistant than normal vegetative bacteria. And you can see some examples of what those bacteria and other organisms are. I wanted to show, when I talked about those levels of disinfection, how this actually corresponds. So mid-level of disinfection generally would disinfect a mycobacteria, and then everything that is less resistant than that. Oh, sorry. So I wanted to just try to have this be meaningful for something that, when we're actually looking at a disinfectant, something that we might see on a label. So we might see these terms sporicidal or virucidal on a label, and I wanted to show you what that means as far as the actual microorganisms. So for example, for a virucidal product, it means that it should inactivate all viruses. So it should inactivate the non-enveloped viruses, definitely, because those are the most resistant, and then it would also cover enveloped viruses. If a product says it's bactericidal and it's a healthcare disinfectant, generally that means that it will inactivate all of the vegetative bacteria there, and it would also should also cover the enveloped viruses. So when a disinfectant has this label on it, the spectrum of activity, of course they cannot test against all of the bacteria or all of the viruses. So what is done is that test organisms are used to make claims on labels. So there are certain organisms that are selected that are representative of that type of, that class of microbes. And those are what is used to test a disinfectant. So we might see a specific pathogen on the label of a disinfectant. So that's what this means. These are test organisms. Generally, test organisms should be, they should have a number of characteristics. Some of them are listed here. And one thing is that it should have, they should be clinically important for the application. So it is a little bit complicated with disinfectants because the test organisms that are used might be different depending on whether or not the disinfectant is intended to be used in the food industry or in healthcare settings. They also can differ by country and geography. But the test organisms, some examples of them are included here, so you can refer to that. So now actually talking about disinfectants. For environmental cleaning, so for our low and mid-level disinfection that we need to do for environmental cleaning, there are a number of disinfectants. Yes?
Sorry, if you could just wrap up. I don't mean to interrupt, but we only have about 15 minutes left for the Q&A. So.
Oh, sure. Okay. So.
And we want to be available for everyone. Thank you.
Sure. Okay. So yeah, this table will be a great reference for you as you're trying to understand what different disinfectant products are and what level they can disinfect at. So I'll just finish here then. So this is the last slide talking about what it is that we're recommending for use for COVID-19. So in making a recommendation here, we need to think about not just SARS-CoV-2, but the other pathogens that we know are present in healthcare facilities. So there are three main types of disinfectants and active ingredients that have been recommended because we know that they are effective against SARS-CoV-2 and other coronaviruses, and we also know that they will be effective against other pathogens. So you can see we have ethanol, hydrogen peroxide, and hypochlorite at 0.1% or 1,000 parts per million. This will be included in that guidance document that I referred to. And so I will just end there. Sorry about going over by a couple minutes.
Fantastic. Thank you, Molly. That was really great. And hopefully everybody picked up some new information and insights. I certainly did. At this point, and thank you for typing your questions. We've been noting them, and I know Madison in particular is taking note of them. I do want to see if Folansade Ungusola, and excuse me for the mispronouncing, who's the lead for ICAN from Nigeria, if she's online and available to say a few words about cleaning and specifically the work of ICAN.
Thank you. Hello.
Hello, please. Yes, proceed.
Yes. Thank you very much. Thank you very much, Molly, for that very insightful presentation. And I think a lot of us have learned new lessons, and it talks to the work we're doing on the continent. Environmental cleaning, one of the greatest problems we have in Africa concerning cleaning is the availability of water. We have a lot of innovative ways of going around that. And if we remember that the WHO UNICEF report in 2016 showed that about 51% of our healthcare facilities had basic, and at least 26% had no access to good water. In the area of environmental cleaning, really none of our healthcare facilities did well at all. And one of the greatest problems is because we see cleaning almost like it's not a medical thing. It usually involves people who are not very well trained. And even when we're doing our infection prevention and control training in many facilities, they're often overlooked, or the training is a little too sophisticated for them because English is not always their medium of communication. And so what we have done in ICAN is we've brought out a book in conjunction with the CDC that is more contextual and can assist people working in IPC and in healthcare facilities to properly address the issues of environmental cleaning. A major area is that we need to give it more prominence in understanding how the environment in transmission of infection, which we often overlook. And I think this is why this particular lecture is really good, because I know that we have a lot of people from Africa on this webinar and can continue to pass the message. ICAN has always emphasized that our training needs to be very visual, that these people, the people who clean especially, and their supervisors need to be engaged more often in and planned for in healthcare facilities. Some models that have been used to improve environmental cleaning is to bring cleaning directly under the infection control office. I've seen that model in a few hospitals and it seemed to work. When the IPC nurse was directly involved in ensuring cleaning occurred. Oftentimes it is not, it's a dual role. So there are all sorts of models. What I think the most important one is we need to train our cleaners. We need to train their supervisors. And as much as possible, the IPC person should always try and work very closely if cleaning is not directly under their purview. Because sometimes what we find in hospitals across Africa is that some things are in silos and cleaning is not directly under IPC. So those are engagements that need to be made. I have just about 5 minutes, and I think the take-home message that I would like to give everybody is, one, read our book because it does help and is contextual. 2, we need to plan more for our cleaning of our environment. In that area, we haven't done too well. And in addition to cleaning, we need to also ensure that we focus on how do we assess that cleaning, that it is clean. It's one thing to do it, but how do we assess it, which is something we have not really taken up across the continent in general. And finally, one message about COVID that I want to also emphasize, because we're seeing a lot of that in our communities, is this spraying of the environment with chlorine. That COVID is inside the people, it's not outside them. So spraying the people and spraying the environment is not going to get rid of COVID. We need to work in a different way and to make sure that we disinfect the surfaces, but not spray chlorine on people. It is dangerous. So thank you very much. Over.
Super. Thank you, Dr. Ungunsola, and especially for highlighting the really practical document that ICAN and CDC has out there, but also that point about spraying, people spraying, just the general environment. That was a question that's come up a lot. So great that you've already answered it. It's not safe. It's not effective. Let's not be spraying our streets and outside our buildings and people. I'm going to ask you all for your patience to see if we could go over just by 10 minutes to 10, so 10 past the hour, so we have a little bit of time for the Q&A. So at this point, I'm going to hand it over to Madison, who's been diligently compiling and synthesizing the questions, and I'll hand it over to him to then read those questions and get the responses from our speakers today. So over to Madison.
Sure. Thank you so much. So let's start with recommendations for the formulation of chlorine solutions for healthcare environments. So this was within Molly's presentation, but I think we should just reiterate as to what the chlorine solution should look like. A specific question is spray of patient care environment using 0.5 chlorine solution effective? Is using of spraying to disinfect the environment a good method of disinfection? So we'll push that one over to the panel. Over.
Yeah, this is Clara. May I talk a little bit about the spraying, reinforcing, and also answering? Is that okay? Maggie, can I go?
Yes, please, Maria Clara.
Okay, thank you. So I thank Shade for mentioning the importance of not spraying. So if I understood correctly, the question that Madison brought up to us, we have 2 points here. One, we have the concentration of chlorine, and another thing is about spraying itself. So it's important to say chlorine is an excellent disinfectant, so it's good, but it needed to be cleaned at the surface before the use of chlorine. And besides this is also when you spray a surface, you cannot be sure how it will affect different surfaces, and it can be not so effective as wiping and let some time to action of the disinfection. And even more, we need to think all the time we use any chemicals. This includes chlorine as well. Chemicals, when you spray this, it goes to the environment, so it can be very toxic for people. So all the time we need to balance the benefits of using disinfectant and use them in a proper way to avoid as much as possible toxicity for human beings. So they have their own indication and proper indication. So over to others to add more information on these questions.
Thanks, Maria Clara. This is Molly. Maybe I would just add briefly to emphasize on the concentration, because I think maybe I saw some other questions. So we are recommending that hypochlorite, so it could be sodium hypochlorite or bleach powder or HDH at 0.1% or 1,000 parts per million would be more than adequate. That's a conservative concentration for SARS-CoV-2 as well as the majority of other healthcare pathogens that we may have. So 1,000 parts per million is the recommendation now moving forward. There are two cases where we would recommend going higher than that, so that's 0.5%. It is really only recommended in situations where the facility has a history of these very hardy organisms. So as I mentioned, these spores, C. difficile, or fungal spores and fungi that are more resistant. C. auris is a good example. So only in that case might you need higher at 0.5%. Or when you are cleaning large spills of blood or body fluids, then the recommendation is also to use 0.5%. But normally you do not have to use 0.5%. It is more than is needed, and it might be a waste of a scarce resource. So that is 5 times the amount of chlorine that is needed, and I think we need to think about making sure that we're conserving valuable supplies as well. So that would be all I would add. Thank you.
Thank you so much. So let's go to, should the water used for hand washing stations be chlorinated? Push that one back over to the panel. Thank you.
Well, that I feel like maybe Maggie could answer that one, or anyone else. That is more not so much a question on environmental cleaning. Maria Clara, did you want to answer that? Sure.
Okay, I can talk, and also possibly Maggie can add something after. So because we're talking about hand hygiene, so let's try to clarify that we need a clean water to hand hygiene. Those is not necessarily it's needed to be chlorinated. So if we have clean water and soap, it's okay. So some places they use chlorinated water, but this is not the first top recommendation. So in general, it's enough clean water. But I would like to receive more comments from Maggie on this issue. Maggie, over to you.
Sure, very, very quickly, and just to note, we are going to try to stay focused on the cleaning, but WHO recommends either soap and water or alcohol-based hand rub. All the details on what other types of materials can be used if neither of those are available are in the new technical note, which I sent the link to. So have a look at that, and feel free to contact us if you still have questions. So yeah, soap and water or alcohol-based hand rub. Thanks.
Thank you so much, panelists. Let's talk about supplies that are used in cleaning of healthcare facilities and whether they should be cleaned or changed after being used in a situation with a COVID-19 patient, and the recommended frequency for cleaning. Specifically, 2 questions regarding toilets, and possibly in the instance where more than one suspected or confirmed patient may be using the same toilet. Over to the panel.
So, Molly, is that okay if I go? This
Yes,
is my
absolutely, yeah.
Okay, so, but please add something after. So, first of all, I think that this frequency of very much kind of situation in which we needed to analyze your own settings. So it depends largely how many people are using particular. For example, if you have a private washroom in a room, it's different that if it's a bathroom shared for different people. So thank you, Molly. Thank you, Molly. Thanks for putting the slide. But it's also, we have minimal frequency, but it's also necessary to have a kind of evaluation each situation to determine how frequent it is necessary. So over to Molly.
Sure, thanks. Yeah, I would just add with regard to the reprocessing of supplies and equipment, yes, ideally after performing cleaning in an area with COVID-19 patients, the supplies should be sent for reprocessing. So, those could be our reusable cloths or the mop heads, the buckets that we would use. So those should all be cleaned and disinfected per normal procedures. So we do already have guidance available for that, for how to manage those. But, basically if you have a commercial washing machine, of course, if you don't, you can manually clean those items using soap and water to scrub, and then soaking in a very dilute chlorine solution for about 30 minutes. So we would recommend about 0.05% for 30 minutes, and then allowing to air dry. So that is that's not anything different because it's COVID-19, but that is how that we would always clean the mops and the cloths that we use for cleaning. On the question of frequency, I completely agree with Maria Clara. I think it's really up to the facility and the resources that are available. What is recommended here are really minimal, but for example, in the question of shared toilets, if you have the resources to have a dedicated cleaning attendant at those facilities and they can be cleaned after each use, that is something that could be considered in a very highly used area, but it may well not be feasible. So you have to sort of take into account resources, but we have some recommendations here which could at least be used to strive for and hopefully go beyond. Over.
Thank you. Next up is a question on the ill health consequences of using disinfectants, and what are the safety precautions that should be put in place for people who are performing cleaning and disinfection. Over.
No, this is an excellent question. So I would like also to receive some comments from Shade if she is still online. If I understood correctly the question, we are talking about which kind of protection personal equipment for dealing with the chemicals. And in general, we need open areas or well-ventilated areas, not open, well-ventilated areas, anytime we are dealing with the chemicals. But I would like to receive some thoughts from Shade about this. Over to Shade.
Is Sade still on the call?
Yeah, maybe she's not available. So would you like to add something?
Unmuted her. Shade, if you're able to speak, hopefully you should be able to speak now.
Hello?
Hi, yes, we can hear you.
Oh, okay. Sorry, I couldn't unmute myself. So can you please repeat the question?
Yeah.
Certainly. Okay, go ahead, Marie-Claire.
Just I would like to receive your thoughts, because the importance of people being protected with gloves and facial protection and gauze when they are manipulating disinfectants. And I would like to receive some thoughts from you and your experience on the protection of healthcare workers when they are dealing in safe way with the disinfectants. Over to you.
Thank you very much. The main advice that we give is really that they should prepare the bleach in very in well-ventilated areas, and anyone who has respiratory problems like asthma and so on, we discourage them from taking part in the preparation of disinfectants, especially bleach. So you don't want all that the reaction. That's the main thing that we actually ask them to do. Because I'm always a little wary when you say wear a mask. But they're here in the gas, working with the gas, with the disinfectant that's in the air, and they tend not to use it properly. So we usually just, at least that's what we tend to do, advise them. If you're asthmatic and so on, don't be part of that. And if you're going to prepare all these disinfectants, then do it in a well aerated place, even if you have to move outside to do it. So that's generally what we advise.
Maybe I might, this is Molly, I might just add briefly to build from Shade. So I think when we're preparing disinfectants and we're working from more concentrated solutions, I think in that case, there are often recommendations that we would protect ourselves, make sure that our face is covered so that there's no risk of splashing or anything getting into the eye and mouth. But generally, when you're using the prepared disinfectants that are already diluted, generally, and of course, what you would need for personal protective equipment depends on the nature of the area where you are cleaning. So for cleaning COVID-19 areas, we do recommend, as you can see in the table here, that the PPE would account for the risk of transmission of that organism. But in a general ward, for example, when we're using disinfectants and we're manually applying them with wiping and with cloths, generally you would only need to use heavy-duty reusable gloves. You would not need to have on other sort of face protection when you're using disinfectants and you're manually applying them. But the PPE that you need depends on the patient care area.
Sorry,
you're cleaning.
Sorry, I think I misunderstood. I didn't take it as the PPE. I thought it was about people who having a respiratory problem. So yes, about splashes and all that. Yes, that's a given.
Thank you so much to both of you. That is absolutely, that's two parts to the question, is the health effects of,
so that was what I was
use
asking,
of disinfectants.
actually. Yes.
And the safety precautions that need to arise in using them. So we have 1 minute left, and one thing that I would just like to bring back to the panel one more time is regarding the use of spray disinfectants, both in a street or a public setting or within an office place, and the spraying of disinfectants on people. I know it is an enormous question to use within the last minute of our panel today, but if I could just get some thoughts from the panel one more time on this. Thank you so much. Over to you.
So this is Maria Clara. Before I hand over to others, thank you, Madison, for bringing back again this issue, because we are seeing many images in the television, and people get the impression that spraying is the solution, but pretty much the contrary. So we needed to always think about the risks involved anytime you use a chemical. So it's not only trying to solve the solution, is spraying everything, everywhere, and everybody. So it's necessary to say again that the spray is not recommended for both surfaces, and even not really recommended for persons. Over.
Great, thank you, Maria Clara, and thank you, Madison. I'm going to interject here because we had planned to have UNICEF say a few final words, and I know we've already taken you already past the hour. So I just want to see if Irene or Amelia, if you're online, if you have any final words you want to reflect on, especially around implementation and some of the work you see happening through the countries. As we know that UNICEF is working in about 140 countries right now on WASH and COVID. So it's obvious that you have a big reach, and I'm sure you're seeing that. So over to Irene and Amelia.
Hello, this is Irene Amongin. I'm a WASH specialist here in UNICEF HQ New York. So first of all, on behalf of UNICEF and WHO, I would like to thank you all for joining this webinar, which is the fourth of 5 webinars in the series. So many of us by now have heard that COVID-19 is transmitted mainly by contact with infected people, but also by droplets of infected persons. And so probably we also know that when droplets from infected persons land on surfaces, objects, they become contaminated when people touch the surfaces and eventually touch their faces. And so they get infected with the virus. And so this very fact makes environmental cleaning an important aspect of our response to COVID-19, and in our case, of course, in healthcare settings. So environmental cleanliness is definitely an important part of our response, as I said, and not only for patients to receive quality care, but also to protect healthcare providers. And now it's even more important than ever in the context of the current context of COVID-19. So we've heard from previous speakers, the experts, Molly and colleagues, on what is entailed in environmental cleaning, from using a multimodal approach and important organization structures that must be in place, including roles and responsibilities for managers and administrative structures, the need for budgets and plans, the best practices, and the use of wash, fit, and cleaning supplies that must also be in place to facilitate environmental cleaning in healthcare facilities. And so as we close, I just wanted to mention one thing that I have learned from today's call, and also reflecting on the previous webinars that touched on water, waste management, and hygiene. And one of the things when I think about washing healthcare facilities is that there is no single intervention that works in isolation. From water, waste management, hygiene, environmental cleaning, and also sanitation, which we'll be looking at this Thursday. All of these interventions must go hand in hand for healthcare to be most effective. So as UNICEF, we're definitely working on all of these areas in the countries. And recently, I think I mentioned in the last webinar that we have adapted the wash fit that Molly talked about. We had adapted it to COVID to ensure that we collect data and track interventions on the minimum indicators on washing healthcare facilities. And we have recently rolled it out, and so the countries that we work in have started to collect information on the situation of wash services in healthcare facilities for them to better provide a response to COVID in the most appropriate way, and also in the most needed areas. And so as I just wanted to urge you also as practitioners to collectively work with other partners to ensure that we prioritize and invest in all of these areas to better respond to COVID-19. So I understand that we don't have enough time, so I just want to say thank you so much for the opportunity to speak, and I just want to encourage all of us to also use wash fit that Molly talked about to make wash improvements in healthcare facilities and to collectively fight against COVID. Thank you so much, Maggie, and wishing you all a good evening and good day, wherever you are.
Great. Thank you so much, Irene. And thanks to all our speakers, to the moderation, and for all of you who have been very active in the chat and listening wherever you are. So thank you, and we hope you have a wonderful rest of your day, and to see you all back here Thursday at the same time, the same place, to talk about sanitation. So thank you.
Thank you all.
Bye-bye.
Bye. Thanks, Maggie.
Bye.
Hi, thank you.